According to the U.S. government's facts about diabetes, currently 25.8 million Americans are living with the disease. That's 8.3% of our population. And of these, 7 million people don't even know that they have the disease. As a home care nurse, I've been teaching and training newly diagnosed and uncontrolled diabetics on disease process and diet and medication management related to diabetes. I have been a nurse now for 2 years, and with the diabetes epidemic, teaching and training related to this disease process have greatly increased over the years. After listening to my speech, you will understand the basic etiology and causes of type 2 diabetes. You will know what to look for if diabetes type 2 is suspected, and you will also know how you and your family can avoid this diagnosis. Type 2 diabetes is an epidemic affecting a large percentage of Americans from adolescence through adulthood. While the complete etiology is unknown, many facts about diabetes remain set in stone. Diabetes mellitus type 2, more commonly known as non-insulin dependent diabetes or adult onset diabetes, is a chronic multisystem syndrome of gradual onset characterized by insufficient body tissue response to the production of insulin and an impaired pancreatic production of insulin. In other words, the pancreas is unable to naturally produce the adequate amount of insulin that's needed to bring down your blood sugar or your blood glucose in your bloodstream. The human body takes carbohydrates and sugar and transforms them into glucose, or sugar, in the bloodstream. This causes the serum blood glucose levels to increase, and the human body naturally produces insulin, which brings these levels back down. Diabetes not only affects your blood sugar levels, it affects your body's ability to lose weight, heal wounds, and even fight infections, making it important for us to watch for risk factors and symptoms. There are several signs and symptoms of diabetes type 2. Approximately 80% of patients with diabetes type 2 are overweight. Patients are commonly complain of gradually increasing symptoms of fatigue, recurrent infections, prolonged wound healing, and even vision changes, as well as neuropathy, which is the lack of feeling and pain in your feet. Hyperglycemia is the term for an elevated blood sugar level. Many signs and symptoms of this are facial flushing, headaches, diaphoresis or sweating. If these symptoms occur after eating or on a pretty steady basis, it may be important to consult your healthcare physician, as well as hypoglycemia, which is a low blood sugar level, which you may notice fatigue, lightheadedness, and even blank stares. There also is a test called hemoglobin A1C that is used to determine blood sugar levels over the past 3 months, and it's common for patients to go in when they're going to see a primary physician and have eaten really good for the past few days, and they think that they're just going to check the sugar and everything's going to be fine. But there are several tests out there that will help aid the physician in seeing if you are compliant with all of your care along the way. With the basic knowledge that lifestyle plays a key role in the risk factors for diabetes, it is easy to conclude that a majority of doctors push for patients to go get their lifestyles under control before resulting to medication therapies. Simple lifestyle changes, such as an increase in physical activity, really decrease your risk for attaining the disease. And this is according to the National Institute for Health and Clinical Excellence. A treatment regimen of appropriate nutrition, regular physical activity, which is at least 150 minutes of moderate aerobic activity, as well as resistance exercises up to 3 times a week, and a desirable body weight is usually sufficient to maintain an optimal blood glucose control and reduce the risk of complications of the disease process. Remember that carbohydrates and sugars cause the blood glucose levels to rise. Therefore, it is important to maintain a balanced diet. And there are many things that people may not know have sugars or carbs. For instance, crackers are loaded with carbs and relatively low in sugars, but because carbs turn into sugars in your bloodstream, that's one thing that you have to watch. Fruit. This basic fruit cup is loaded with sugar, and a lot of things have sugar added to them that you don't know of. And many people like to count out drinks, sodas. Alcoholic beverages are the worst because not only do they have sugar, but they have alcohol, which both of those turn into sugar in the bloodstream. Remember, it is important to understand that there are some predetermined risk factors to diabetes as well, such as age, gender, and nationality. This makes it increasingly important to get up off the couch and take control of your life. And now that you have a better understanding of diabetes type 2, the signs and symptoms of how to treat yourself and prevent yourself from getting this disease, I hope you all take part in reducing the statistics here in America. Diabetes is one of the leading causes of death in the United States. It encompasses more than just your weight and sugar levels. Diabetes is preventable and controllable through diet and exercise. Instead of having a snack time and a dessert time, maybe parents, siblings, and friends can make it a point to have playtime and fun time. After listening to the facts about diabetes, it is my hope that you may take charge of your lifestyle and help others move towards a more healthy lifestyle. Now that you all have an understanding of the importance of preventing type 2 diabetes in your life and the lives of those you love, I hope you all get out and take control.